Hello, I'm Elizabeth. I'm a physiotherapist, and this video is being made by request to explain how to turn on your hip cuff muscles. So I thought I would start by explaining what these muscles actually are. So you may have heard of the rotator cuff of the shoulder. So these are really important muscles for shoulder health, and essentially it all boils down to they help the arm bone stay in the center of the shoulder socket, which is important for shoulder health, preventing injury, good function, all that sort of thing. And the hip is a very similar joint in that it is a ball and socket joint, and these muscles also help the thigh bone to sit into the center of the socket. And this is important because for most of us, we tend to have our hips or the thigh bone sitting a little bit more forwards in the socket, and in the majority of cases arthritis happens there in that front top bit of the socket because it just gets a bit more action, a bit more wear. And I don't say this to alarm anyone. It's not a terrible or scary thing. It's not like it's going to come out of its socket when we talk about it being in the center. We're just talking about very fine adjustments, so yeah, nothing to worry about there, but yeah, just for optimal hip function and to take a little bit of strain off the front of the joint, we want our thigh sitting in the center of the socket, and yeah, so this is what these muscles do. Okay, so I've just relocated myself down onto the mat so we can get into the exercises. So we just want to push our fingers in to feel what's happening, to get a bit of feedback, because what's happening is very subtle and people get a little bit confused or discouraged thinking that they're not doing anything. So we want to go along the line of the lap and just feel for that hip flexor muscle. You can lift your leg if you're not sure where it is, the big ropey thing, and you just come in of that towards your midline along that line of the lap, and you're just going to feel in there. And so essentially what we're doing is trying to suck our thigh bones into our hip socket. So I'm just lying here with my knees bent. For some people, for a bit of extra help, they might have their legs resting up on say like a couch or a footstool or something, just so there's extra gravity assistance into the hip socket, but we're just going to keep it simple today like this. So what I want you to imagine is like the telegraph poles that carry electricity, just a big heavy pole sinking down along the line of the thigh into the hip socket, through the hip socket, down into the floor. So it's just coming down, 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 sinking in towards that hip. So it's very subtle, but let's just give it a go. So popping your fingers just inside those hip flexors, and then just that feeling of sucking the thigh bones into the hip socket. And you might just feel a little bit of tension under the fingers. It's very subtle though, so don't expect something big. If you are feeling something big, like the hip flexor tensing and jumping up, we don't want that, so that's different. So yeah, just monitor yourself for that. But yeah, let's just try that again. So you're thinking of the thigh bone sinking deep into the socket, very subtle. So you can't see anything happening with me when I turn it on. It's because there's nothing to see. These aren't big power movement muscles. They're tiny stabilizing muscles for the hip. So that's what we're doing to turn on the hip cuff there at the front. So if you find that your hip flexors, you can't get them turned off, they're sort of really jumping and sort of flicking up, there's things you can do. So before doing this, you can release them with a massage ball. So I would do that lying on my front. So you just find that tendon and put the ball on it and lie down. It's not going to feel good, but it might feel good after. I don't recommend stretching hip flexors because it encourages the thigh muscle to go towards the front of the hip, which is what we're trying to avoid. So yeah, you can do that, and if you're getting a massage ball, it's also good to get into the TFL muscle. So if my hip bone's there, it's just behind there. That one also feels horrible, and also in just to the glute muscles as well. So you can do that lying on it or against a wall. So yeah, that's the hip cuff muscles at the front. So once I've got those turning on, I like to bring them into some combined movements to really help get a strong synergy happening here through the core. So the way I do that is you can have a sort of a small ball or a cushion. I've got a towel here, putting it right up at the top of the legs, and what we're doing is first of all starting with the pelvic floor. So if you don't know how to do pelvic floor, they're our muscles that stop us from peeing ourselves and that sort of thing. So if you're not sure how to turn them on, you can pop your fingers on your hip bones and then just come inside of that and imagine like you're stopping the flow of urine. So it's a squeeze and a lift that happens in the pelvic floor. Or you can think of like a tampon that you're sort of picking up and drawing into the vagina. So so turning on the pelvic floor, that comes first, and then the suck of the thigh bones that we've just taught, so they're drawing in. And then the third movement is an inner thigh squeeze. So with this inner thigh squeeze, you don't want it just to be like a big clamping action. We want to make it a wishbone shape, and by that I mean you're sort of thinking your two thigh bones are coming down and together. So it's not just down, but it's also that wishbone togetherness. So that just helps you keep that activation of that deep cuff. So we can do that together now. So turning on pelvic floor first, then sucking the thigh bone into the hip socket, and then a gentle squeeze where I'm squeezing in but also down. And I would aim to hold that for 10 seconds, but you might only be able to do a few seconds when you start, and that's perfectly okay. And then you just release it. Make sure you're releasing pelvic floor all the way when you do this as well. So then you just do it again. So pelvic floor first, inner thigh drawing in, sorry, not inner thigh, but the deep hip cuff, and then drawing the inner thighs together. So it's subtle, like you're not doing much, but it can actually be quite strenuous to do this. And just monitoring yourself for jumping through the hip flexors when you do that one. So that's the front hip cuff muscles, and now I'll just show you at the back. So you want to have this pillow or whatever you've got between your knees still, and I've just got my legs forwards, not quite 90 degrees, but they're not as far back as you might in a clam position, if you know what that is. So for these muscles, we find them by feeling our sit bones. So you know that the pelvis bone that you sit on, and I'm just putting my fingers there. And so what we do with this one is you can imagine like you've got a vacuum cleaner attached to your jeans pocket, and it's sort of sucking your thigh bone up and back, or like a sea anemone that's sort of sitting there in your back pocket, sort of sucking the thigh bone up into the hip socket. So just figure out what imagery works for you, but yeah, just getting that little bit of a suck up into the hip socket, and so I can now feel a bit of tensing happening on my sit bone. Some people just can't quite get it doing that, and that's okay. Another way you can get them working automatically is by just doing a little bit of a heel squeeze now. So my heels are already touching and together, and I just squeeze them. It doesn't sound very nice, but as if there was like a little ant between your heels and you're just squashing the ant. So yeah, if you can get this going first, so sucking up through here, and then we add in the heel squeeze anyway, even if you can get it with the first bit, because that just gets a bit of a stronger contraction. And you just want to watch yourself that you're not starting to tense through the front of the hip. Those hip flexors can really want to come into play. But yeah, you should feel that tensing happening there in the back of the hip. So there you have the front of the hip and the back of the hip. And once I've got this happening well, sometimes I like to bring that into a clam muscle exercise, just to make sure you're really using those good deep hip rotators, and not just more superficial ones like the piriformis, which can get a bit tight. I can show you that now actually, if you like. So if you were going to do a clam, I take away the pillow, and so turning on the hip cuff muscles, squeezing my heels, and then getting a bit of a rotation up into the clam and holding that. It doesn't have to go too high, and then coming back down. So yeah, that's the hip cuff. What I will say is that these, they're really subtle, very abstract, so don't beat yourself up if you can't get these happening, or if you feel like you can't. I find most clients that I work with, even if they are doing it really well, they still think that they don't. They're sort of paranoid that it's not working, just because there's not much to feel. It is very subtle, but that's the nature of these muscles. So if you just are completely confused by this, don't beat yourself up. It is a really tricky thing to learn remotely without someone giving you that direct feedback. But give it a go, because it is a worthwhile thing to do. Really amazing muscles, and even if you have had a hip replacement already, this is still really good for you. I've done this with a lady who was having trouble with her hip replacement, getting lots of clicking and pain, and just helping it sit a bit more centrally really helped her a lot. Okay, so thank you for watching. If you've got any questions or comments, feel free to put them below, or any requests for other videos that you would like. Very happy to take requests. Okay, thank you.